Ragini is a volleyball player. During a volleyball game, she twisted her ankle. She was able to get up and bear the weight with support. As a coach, therapist, or a trainer, you advised her to stop playing since you want to prevent further complications. Your team masher asked her to get back to the room and apply a hot pack to hasten up healing. So what physical modalities must be used in an acute injury setting? Is it cold or heat application? What is the rationale? What methods are available? If you are looking for answers to such questions, you are at the right place. Welcome to NPTEL offered course on physical medicine and rehabilitation in sports, and to this week 7 on physical modalities and other alternative therapies in rehabilitation. Today's lecture is focused on physical modalities in rehabilitation. You are with me, Wing Commander Chandrasekhar Guru. I am a sports medicine physician, associate professor with Department of Sports Medicine, Armed Forces Medical College, Pune. The learning objectives of this lecture will be understanding the physiological principles and therapeutic effects of both heat and cold physical modalities. We'll discuss about the rationale of prescription based on different available modalities and the condition or the phase of rehabilitation. What are the practical aspects? How do you use them in your day-to-day sporting scenario using case scenarios? So, general principles of heat and cold are heat and cold, as we know, are traditionally used modalities, right? So the law of energy conservation states that energy can either be created nor be destroyed, so it can only be transformed. So that is the kind of principle that is the basic foundation for the physical modalities, where the heat is transferred both in hot as well as cold. It's transferred either by conduction, convection, or radiation. So the tolerable temperature, since we are using these modalities in ourselves as humans, so the tolerable temperature range for this in our body is 15 degrees Celsius to 45 degrees Celsius. This temperature, it depicts the core temperature, core body temperature. So how does the body respond to the temperature change? See, we have certain receptors which kind of detect the heat as well as the cold. So these are hot and cold skin receptors, and as we discussed, the tolerable range is 15 degrees Celsius to 45 degrees Celsius. So no physiological damage as such happens within this particular range. Especially when the temperature is around 30 degrees Celsius, the core body temperature, these receptors are highly kind of sensitive. So even a 1 degree kind of change in the temperature kind of immediately triggers this receptor. So when the temperature is around 30 degrees Celsius, the receptors are highly effective, whereas when it goes towards the extreme, the kind of sensitivity kind of slightly reduces. The region of thermal comfort, when we say, it is between 15 degrees Celsius to 25 degrees Celsius, and beyond the tolerable limit, what happens if the temperature is beyond 15 degrees Celsius on the lower side or 45 degrees Celsius on the higher side? What happens is your pain receptors are stimulated, so pain will be felt after beyond this temperature range, and it may cause tissue damage. So that is when your central behavioral kind of regulation starts, wherein you try to avoid this particular exposure. Say if it is beyond 45 degrees Celsius and there is pain, you suddenly try to withdraw it from the hot environment or hot substance. So that is the behavioral regulation that happens because of the extremes of temperature beyond 14 degrees Celsius to 45 degrees Celsius. When it is cold, what you will do as a behavior, you try to avoid such cold places or wear additional clothing to kind of comfort yourself. So what about the physiological effects? The physical changes that happens because of the temperature difference, that the metabolic rate kind of varies. With every 4 degrees Celsius, there is an increase in 50 percentage of the basal metabolic rate if the temperature increase, or it decreases by 50% if the temperature drops. So that's called as Bands of law. That's very important to understand. With every 4 degrees Celsius change, temperature change, the basal metabolic rate halves. So that's an important aspect. That's because of the effect that it has, the temperature has on the blood vessels as well. The beyond this acceptable tolerable range, what happens is there is denaturation of the protein. So we know all the enzymes are all made of proteins, right? So the enzyme denaturation happens. So the enzymatic activity also comes down and causes cell damage. Viscosity of the body actually increases. It has a direct relation with temperature. When the temperature increases, viscosity increases. When the temperature decreases, the viscosity comes down. So the collagen also has a direct relation. With heating, the collagen softens. So these effects can be used in therapeutic uh, effect as well. Like physiologically, if you see, with the temperature there is stimulation of the sensory nerves. Cooling reduces the nerve conduction because of the numbing of the particular tissue. So and eating increases the nerve conduction. Temperature on blood vessel, what it does is, it if the temperature increases, there is vasodilation, there is increased blood flow. When the temperature kind of decreases, the blood vessel constricts, that is vasoconstriction. So based on this inputs about the changes that happens because of the heat and the cold or a temperature change, what effect it has on the eating has on the body, how you can use it for as a treatment modality in individuals. So because of the effect on the metabolic rate and the blood vessel, increased vasodilation, these effects causes an increase in the acceleration in the tissue healing, because better blood flow, removal of the waste products, the metabolic activity increases. So that means more cells are there, more healing process takes place. So that way there is acceleration in the healing that happens in the tissue. Because of again removal of the waste products, pain gate theory, superficial sensory fibers are kind of triggered. So by the heating response, so that causes reduction in the pain as well. Also it has central effect causing sedation. Say you might have experienced it when you go take a hot shower in the night, you feel you go on to sleep faster, early. So that is an effect of sedation that heat has on the central nervous system. Reduction of the muscle spasm, we saw that temperature kind of directly has an effect on the collagen, softening of the collagen tissue as well as the viscosity, right? So this directly affect the muscle whenever there is a inflammation or an injury, it goes into spasm, right? So this particular eating modality kind of reduces the spasm. Reduction of spasm itself can reduce the pain as well. Further, the extensibility of the tissues improves, so it helps in kind of increasing the range of motion as well. Since the extensibility and the range of motion improves, it can be used as a precursor and a complementary mode of treatment with other therapies. Like it can be used before stretching, if you go in for increasing the length of the connective tissue or the muscle. Mobilization, where you use in chronic cases, you go for where tissue additions are there, soft tissue additions, you go for tissue techniques, massage techniques, or joint mobilization. So these are the aspects that can be done in chronic cases. You can use a eating modality prior to that, so that helps in kind of a better outcome when it is combined with these modalities. So having known about the basic principle, what are the physiological changes that temperature brings in, and how it can be therapeutically used, it is important also to understand what are the different modalities that are available. So you can broadly classify them as superficial eating modalities and deep eating modalities based on the depth of the tissue that gets eaten by the use of certain modalities. So superficial eating modality is generally direct heat from outside transferred to the skin and the subcutaneous tissue immediately lying beneath the skin. So it can be either by conduction, convection, or radiation. Deep heating is mainly to target the deeper tissues. So where direct heat transfer is kind of it is not possible to have that in the depth penetration. So you use a conversion principle where electrical energy using electromagnetic waves can be used to cause heating at the deeper tissues. So it's the alternating electric and magnetic waves at high frequency which causes the heating at the deeper tissues. So looking at the superficial heating modalities, using conduction principle are hot water bottle. You place the hot water bottle or a hot pack or a heating pad or a wax bath where you dip your extremities in direct contact. So by the process of conduction, the heat is transferred from the high ambient kind of temperature to the low temperature, that is the tissue. So there is heat transfer by conduction. The another method is convection, wherein convection is a method wherein you have a layer of heated liquid or air that is passing through the body. So it can be an water based, hydrotherapy based modality, or an hot air blowing. That again is a convection mode of superficial heating. The radiation mode is by using infrared. We know that every object emits infrared, right? So you use an infrared lamp or something like which can emit high dose of infrared, and that radiation which is emitted from the source kind of heat the tissue that is closer to that particular lamp or the equipment. So deep heating modalities, as we discussed, it uses alternating electromagnetic waves which are generated by the electric current. So it can be short wave diathermy or microwave diathermy based on the source through which the the electromagnetic waves are produced. And you can also use ultrasound therapy for using the thermal effect, using sound waves which are rarefied and compressed waves, which causes mechanical movement of the molecules and heat produces in the deeper tissue. So ultrasound also can be used as a deep heating modality. Let's see in brief about these modalities. Coming to hot packs, is one of the commonly used modality in every household. It's a easier available tool wherein superficial therapeutic heating effect can be made. It can be used using a commercially available pack, or you can also use cloth dipped in hot water and then the water squeezed out and then can be used, or you can also use a water bottle where you can fill in the hot water and then that can also be used. So the modality is almost the same by conduction. You can also use commercially available hydrocollated gel packs also can be heated using microwave, or you can use a bag containing say wheat, so that also, or sand, that also can be used as a kind of heat pack, hot pack, which can be heated using microwave or some other modality and can be used to be kept over the region. So this is generally wrapped over towel so that direct contact is avoided and burns can be avoided. Generally applied for 15 to 20 minutes. Care should be taken that it's not directly applied, so obviously it may cause burn injury. So the temperature at which you are placing it should not be beyond 42 degree Celsius at the skin level. It may be applied, maybe it is also important to check the response by the skin as well. So people may be kind of responding have hypersensitivity to either heat or as well as cold, so that needs to be checked. After application, it's important to check after 5 or 10 minutes to see what is the response of the particular individual to hot pack. Moving on to something very commonly used modality in physiotherapy units, that's wax bath. It's more of a local heating effect on the extremities, because extremities it's useful to use wax. The wax used is the paraffin wax. The temperature maintained is 42 to 52 degrees Celsius. Though we say 52 degrees Celsius, it is just to keep the wax in the liquid form. When you use it as a modality, you kind of use two different ways of application. One is the dip and wrap, where you dip the extremity into the wax bath and then you allow it to kind of solidify. So even though it appears that the temperature is high, as soon as it is applied, it kind of the wax solidifies by losing absorbing heat, so by which it is kind of the temperature actually which is being transferred to the skin will be much lower. So that is why it is tolerable, within the tolerable range. and a layer will be formed as a solid layer, right? So now again you will have to dip it inside to form the second layer. So you can make multiple layers over it and kind of form a solid wrap over the region, and then it can be wrapped with a covering. So that is kept for 15 to 20 minutes so that the heat is not lost out to the environment. The other method is that you can make multiple layers and then keep it inside the wax bath itself to maintain the temperature of close to the region where it is applied for about 15 to 20 minutes. That's how you can use wax bath. It can be used as a precursor, as we discussed. Wax bath can be combined with exercise, therapeutic exercise, or even with stretching. So it has a compounded effect. So coming on to the next convection mode of superficial heating is then hydrotherapy or a whirlpool bath, wherein you can use it using the convection principle. Stainless tank with some degree of heated water is there, and that can be used for the entire limb or for the entire body as well. Depends on the size of the tank that is being used. Temperature is generally maintained between 36 to 41 degrees Celsius. Duration of application is about 20 minutes. It generally also causes a analgesic effect by the pain gate theory. The whirlpool is nothing but a movement that happens in the washing machine, something like that. So you have the water kind of making movement within circular movement within the tub. So that kind of causes or stimulates the mechanoreceptors of the immersed region. So that is one aspect of it where the mechanoreceptors are also stimulated by the movement of the water, and you also, because of the heating effect, you have the thermal receptors also stimulated. It is important also to consider to add an antibacterial agent because generally the same bath is used for multiple individuals, so there may be some open wound also from previous patients. So it is important that the water which is used has to be disinfected, and you can use sodium hypochlorite as an antibacterial agent as well. And it's preferred that the water is changed again and again. So if you use a whole body immersion, then water again, that becomes a kind of a drawback. One of the important aspect or side effect, you could say, because of the limb has to be kind of dipped inside, right? So it is in a dependent portion. With the injury in the extremities, there may be increase in the edema because of the gravity effect. So after the treatment, it is advised that the individual may be asked to elevate the limb. Moving on to the deep heating modalities, diathermy we discussed is one of the common deep heating modality. So it uses the electromagnetic waves. The electric waves and magnetic waves are placed at 90 degrees, and then they alternatively pass, and then they cause the heating effect at the deeper tissue. In case of short wave, it uses a radio wave, short radio wave at 27.12 megahertz. High frequency waves are used to produce the heat, whereas in case of microwave, it is again the frequency varies. It is slightly lesser compared to the short wave, and then it is the magnetron which kind of produces the microwaves. So it is well observed by the high water content tissues like muscle. The alternating waves, as I had explained, causes the deep heating in the tissues. The duration is generally about 15 to 20 minutes. You can keep the dosage from mild to moderate. It's a subjective warmth feeling. The individual has to give you the response whether how warm the individual is feeling, and hence it requires monitoring. And you can also give it in two different modes, as a continuous mode or as a pulse mode. So it is seen in pulse mode, it kind of gives that gap in between two different pulses, so that kind of also helps the body to kind of adapt as well to the heating therapeutic effect that has happened in the region. Contraindication is that any implant which is there, metallic implant, it is bound to absorb this heat and then kind of hold it within the metal, and that can kind of cause deep burns as well. So it is important, if there is an electronic implant like a cardioverter or that can kind of dysfunction because of the heating. So that needs to be taken consideration. Moving on to the other mode of physical modality, that is the cryotherapy or cold therapy. It is basically to decrease the temperature and use it as a therapeutic application of the body by removing the heat. So, the optimal temperature in case of cryotherapy is to be maintained at 10 degrees Celsius to 15 degrees Celsius. The duration depends on various factors, namely the modality that is being used, what is the depth, the size of the target tissue that where we are using cryotherapy, what is the fat content in between, because fat again kind of limits the penetration of the the cryotherapy. So, that again will delay. So, accordingly the time also will be increased. So, duration depends on all these aspects. So, therapeutic effect, what is the therapeutic effect? It helps in controlling inflammation. So, hence it is part of that PRICE protocol. We have been discussing this over the last 4 weeks. What happens is that if there is an acute injury, the immediate primary injury to the cells happens, and certain cells actually survive the initial insult, but however, because of the subsequent hypoxia and enzyme release, it causes secondary injury, and then it further causes cell death and enhances the complication, right. So, cryotherapy right immediately after the injury arrests this particular aspect. So, it decreases the temperature, thereby the metabolic rate decreases, the enzymatic action decreases, it also kind of decreases the edema. So, these effect causes delays or avoids the secondary injury that happens to the cells that has survived the injury. So, that is an important aspect wherein it helps in controlling the inflammation and prevent further kind of damage to that injured tissue. Secondly, because it kinds of numbs the tissue, it also uses the pain gate theory concept to kind of relieve pain as well. It also reduces the muscle spasm because the temperature is dropped. So, the muscle spasm also reduces, because of which it can also be combined with therapeutic exercise as well. And it also helps in facilitating the muscle activity as it reduces the pain as well as the muscle spasm. It can also aid in muscle movement. So, even cold therapy can be used for improving the range of motions, called as cryokinetics. The various modalities that one has to know about cryotherapy are commonly used. Every household we use this ice packs. You have this gel packs can be kept in the refrigerator and made frozen, and then can be used. Even a simple water bottle can be kept in the freezer and can be used as a cryotherapy modality. Even green peas, we commonly use it in our kitchen. So, green peas can be kept in a bag, and then that also can be used as a local cryotherapy modality. You also have commercial cryotherapy units in high performance centers where it is important that the accelerated rehabilitation is required. So, in such centers, you have cryotherapy units where you can be using a cryoflow therapy, or you can be using the conduction based. So, in the picture you see the applicator which the therapist is holding. You can set the temperature. It can be used for both heating as well as cold, wherein you set the temperature, it immediately kind of causes cooling, and that particular applicator cools down to as low as even 0 degrees Celsius, and then when placed on the tissue or the skin, it causes cryotherapy immediately. So, depending on the temperature that is set, the duration also has to be determined. Cold water immersion is again a useful modality, especially for extremities, because extremities conduction modality, because of the uneven in the surface, it becomes difficult. They may not be equally distributed. So, it is easier to kind of dip the entire extremity onto the cold water with a lot of ice in a bucket of water. Ice towels, again ice towels a good form of cryotherapy modality. In fact, in recovery in between sessions, you would have seen famous tennis players wearing ice towels in between sessions. So, ice towels also can be used as a good cryotherapy modality. Ice massage, specifically in sports rehabs, you can use ice massage, something like kulfi stick with the frozen kind of mold. You can use that as an ice which can be used to cause some massage over the superficial tissue. So, that is also found to kind of use this cryotherapy modality in healing. Evaporative cryo sprays, commonly you would have seen in commercial sports like cricket, you will find these physiotherapists running with a spray, and the magic spray is kind of blown over the injured area, and the individual immediately goes on to resume playing. So that is the cryo spray, which generally also have some local skin irritant, kind of using the pain gate therapy to reduce the pain immediately. Let's see about ice packs. Ice packs again use the concept of conduction, most commonly used modality, part of price protocol. It can be used with a towel or a bag, not to be used directly on the skin, maybe because of the hypersensitivity reason. It has to be checked after application, and inspect every 1 minute to 5 minutes to avoid the injuries that can happen because of the extreme reduction in the temperature. The duration is generally 15 to 20 minutes depending on the depth at which you want the cryo effect to happen. The last modality using the heat as well as cold is the contrast therapy. Contrast therapy, as the word derives, it uses both the modalities alternatively to produce a pumping effect. So the rationale is alternate vasodilation and vasoconstriction. So that kind of produces a pumping effect and helps in kind of increasing the range of motion as well as helps in healing, and it reduces the pain as well as spasm. You generally used in phase 2 in chronic pain cases as well as in delayed onset muscle soreness as well. The protocol is you use with start with the heating modality, 3 to 4 minutes of a hot pack or a hot bottle, and then immediately subsequently you keep a ice pack for about a minute. Then you repeat the cycle for about 4 to 5 cycles, and then you kind of end it with a cold, so that if swelling is present. So let's see a case scenario how we can utilize it practically. So we started with this question: Ragini, a volleyball player, twisted her ankle and she was able to bear weight, but then you had stopped the individual from further playing, so you prevented the further complication. But however, your masseur says that the individual to apply hot pack. So the question we asked for whether what should be the modality used in the acute setting, whether it should be heat or cold modality, what is the rationale and what are the methods that are available, right? So I think if you have listened to this lecture, you must be able to answer these questions. So it's an acute injury, but not very severe because the individual was able to bear the weight. So you have advised to stop the play, which is a very good aspect. You protected the injury, the injured region, so that it doesn't get further aggravated. Physical modality, acute injury, ice, because it causes, you need vasoconstriction to happen, right? Because injury as such triggers the inflammation, and 5 signs, cardinal signs of inflammation is one of the signs is that increase in the kind of pain as well as in the terms of blood supply. So and swelling. So all these things have to be arrested immediately in order to prevent the secondary injury to happen. So ice application is the important thing. In case if you apply heat, what happens is it further increases the blood flow. As such, there is increase in blood flow or maybe some bleeding, that is increasing the swelling. So further it will increase the swelling. So that may compromise on the healing. So with ice application, as we discussed, it decreases the metabolism. So decrease blood supply and decrease the secondary injury effect. It also decreases the pain. Method is you use local application or an ice spray wrapped in a towel. You can use local if you're using a cold pack. Combine it with a compression for better outcome, so that the swelling further reduces, and you can also elevate the limb. The duration is 15 to 20 minutes, and you can repeat it every 2 to 4 times in a day, at least for the first 3 days when there is acute inflammation setting. Generally, the dilemma or the question that one has is that you need inflammation also for body to kind of respond to the injury and heal it on its own, but then ice application is going to counter that, right? So whether it is logical to use ice application or not, that's a common dilemma that one has. So inflammation process is very much required, there's no doubt about that. However, ice application is not that you are using completely for 72 hours, right? So you are applying only for fixed duration, and then it is only to control the excessive inflammation that has happened. So by just applying for 15 to 20 minutes and at a distributed period, it is not going to actually kind of reduce the inflammation. It is only going to control the inflammation. So it can be very well used in an acute setting. To summarize, physical modalities, heat and cold are traditional forms, Aligning them as per the phase of the sports rehabilitation gives you better outcome. Acute, use ice and club with compression and elevation of the limb. Phase 2, going for contrast therapy, reduce the pain, increase the range of motion as well as reduce the spasm. Chronic cases, phase 3, you can go for eating modalities. Superficial, go for superficial eating modalities. Deep, go for diathermy and ultrasound therapy. Hot packs and infrared lamps are the commonly used superficial tissue healing. Diathermy offers deeper tissue heating. Cryotherapy can give immediate cooling effect and then it can give a better outcome. So, for those of you who are interested in further kind of in-depth reading, these are the following references that you can go through. Thank you for attending this lecture. Jai Hind.